The following program has been developed in cooperation with the American College of Rheumatology, the doctors who treat arthritis.
Arthritis is not something that's gonna ruin your life. I mean, you just can't stop living because you have something in your body that makes things a little bit more painful.
I think without a positive attitude, you can't get by anything. You know, you always look for the good side because you can always find something bad.
I've certainly assessed lots of my life in a very different way now that I've had something to sort of slow me down a little bit, sort of weed out the things that aren't that important and do the things that are very important now.
I think for a long time in my era, my age group, you were kind of taught that you grin and bear it, don't complain. But today, to ask for help is not a sign of weakness.
Any person with arthritis, they should understand what is happening physiologically. They have to understand their body. The body is telling something. Don't despair, don't give up.
Feeling Good with Arthritis, a production of Xenakis, a healthcare communications company.
You're not alone if you have arthritis. It's the nation's #1 crippler, affecting some 37 million Americans. Arthritis literally means joint inflammation, but it's a broad term denoting any one of 100 different disorders affecting the connective tissue of the joint. The most common forms are rheumatoid and osteoarthritis. The difficult reality is that there's no cure for this disease, but you can manage the pain and you can prevent major disability. Even with arthritis, you can feel good. During his 18-year career with the New York Yankees, Mickey Mantle became a baseball legend. He won 3 Most Valuable Player awards and was on the top 10 all-time home run list. His fans knew and loved him as the switch-hitting slugger that could do it all. What they didn't know was that repeated injuries to his knees would soon bring his career to a grinding halt.
My knees just finally got so bad that I could hardly walk, much less run and play ball. So I had to retire in the spring of 1969, and it was probably the saddest time of my life. I used to have a reoccurring nightmare that I was trying to make a comeback, and because of my legs, I couldn't quite make it to first base. I'd get thrown out from right field or left field, and I missed it a lot at first, but I'm getting over it now.
Mickey had become one of the 20 million Americans with osteoarthritis, the degenerative wear and tear arthritis that develops slowly over time. Common in athletes, it's usually associated with aging. In fact, all of us have a good chance of developing osteoarthritis at some point in our lives.
Osteoarthritis and rheumatoid arthritis are among the most common forms of arthritis, and they have very different causes or processes involved in them. So we think of osteoarthritis as a degenerative type of arthritis. It's a wear and tear problem. Things just wear down with use and over time. Rheumatoid arthritis seems to have a whole different process involved. It's an inflammatory kind of arthritis where the body puts out chemicals and so forth that are related to inflammation, somewhat similar to what would happen in an infection.
Well, that's my worst one. This is my good one. Yeah.
Osteoarthritis begins as a breakdown in the joint cartilage, the tough material that cushions and protects the ends of the bones. It most commonly occurs in the hands and fingers, but it can also occur in the neck, back, spine, hips, knees, and ankles. It normally doesn't affect the whole body, but instead 1 or 2 specific joints. While Mickey Mantle knew his playing had generated the problem, it took a while to recognize that the pain wouldn't go when the playing stopped.
I got to where I couldn't even play golf. I'd just go out and ride around and watch the other guys. My legs were so bad that I just couldn't play at all.
Mickey's now accepted his condition. It's estimated that it takes people 4 years after developing symptoms to seek treatment. Unfortunately, the longer a person waits for help, the greater the potential damage.
Now that I look back on it, at the time, you know, I was only 36 when I had to retire, you know, and guys that did take good care of themselves, like Willie Mays and Hank Aaron and Stan Musial, those guys are all the guys that are up in the top of the record books. And now that I look back on it, I know that I could have been there had I taken better care of myself. I didn't do my exercises. I had a lot of operations on my knees, and they gave me exercises to do. If I would have done them, my knees wouldn't have gotten the arthritis in them in the first place, probably.
While athletes are pushed to play past the pain, there was no denying the pain for Evelyn Godolphy. Evelyn has rheumatoid arthritis. It's one of the most disabling forms of arthritis, and it commonly strikes women in their 30s and 40s. Evelyn was 36 and surprised to suddenly find herself physically challenged.
When I first was diagnosed, I wasn't on medication, and it gradually got to be very, very serious, and to the point where I couldn't go up and down the stairs almost at all without crawling up and down the stairs. I had one child at that time, I have two now, but I would get down on the floor to play with him. I wouldn't be able to get back up again.
The cause of rheumatoid arthritis is unknown, but what is understood is that it's an inflammation of the synovial membrane, a fluid-like sac that surrounds and protects the joint. One theory holds that the inflammation occurs because the immune system mistakenly identifies something in the joints as foreign and attacks it. Another leading theory suspects a virus as the cause. Rheumatoid arthritis affects both sides of the body equally and can cause pain, stiffness, tenderness, and swelling in the hands, elbows, hips, and knees.
You know, you might be doing something, you look down at your hands and say, my God, whose hands are these? These are not my hands. You know, they're somebody else's hands. I never had, you know, joints that are swollen before. And suddenly you realize these are connected to me. This is my body now. I have arthritis. And it's sort of like these are the small things that make you, boom, aware that, yes, I have this illness.
Evelyn feels you overcome the obstacle of your illness when you accept the new you. She feels arthritis is like having a new roommate move in. You may not like it, but you accept the reality that you may be spending a lot of time together.
I think that if you just sort of sit back and wait, things won't change that much. You have to just sort of keep on going and doing things and finding ways to sort of cope and survive.
Exercise is a crucial component of any program in making you feel better. It not only improves your overall health, but increases the flexibility and range of motion of your joints. Now, if you haven't selected an exercise, walking and swimming are two great ones, but you don't have to go outside. You can stay indoors. Using a stationary bike is easy on your joints, or a portable home spa or whirlpool provides warmth, stimulation, and buoyancy to your exercising muscles and joints. But whatever you decide, the most important point is that you begin and use what works for you. Jose Navarro feels exercise is a savior in managing his arthritis. He started developing osteoarthritis of the hips 23 years ago when he fell in a work-related accident. As his condition worsened, his doctor recommended total hip replacements as the best solution for relief.
And I was not eating right. I was neglecting my exercise. And the doctor says, if you don't have total hip replacement of the two hips, in 6 months you will be in a wheelchair for life. And I cried three days like a kid, you know. And afterwards, I remember in Mexico City, I was a champion in handball and racquetball. So I say, I'm going to condition myself.
Jose wanted to avoid surgery and hoped exercise was the answer. One reason people with arthritis are reluctant to exercise is the fear that it will aggravate their condition. In fact, for many people, just the reverse is true. Stiff or painful joints need to be moved through a complete range of motion each day. If you don't use your joints, they'll lose their strength and their mobility.
When you wake up in the morning, you are rigid, tremendously rigid. You cannot move. All movement is painful. You have to move. If you don't move, you become more rigid, and being more rigid is not good for you because you become paralyzed, you know. So you learn to exercise. Also, I get the pain in my low back. And later on radiates to the legs because the sciatica nerves goes through that area. So you get more pain, and who wants to have more pain? And the pain paralyzes you. So you have to move. I stand up, I do bending, I move my legs, I move my hips, I move my hands. Moving is a solution. Increase circulation, make those muscles work. You see, your muscles don't work too well. I'm very unbalanced. I work with 2 canes. And when I walk very unbalanced. I overwork some muscles and underwork another muscles. And I'm in pain, and it shows, you know, in my face, and I walk like a duck, but I swim like a dolphin. That's my salvation.
The type of exercise should be matched to the severity of the arthritis. Swimming is actually the ideal exercise, especially for osteoarthritis. You need to avoid putting any undue pressure on your weight-bearing joints. That means steering clear of any exercise that has sudden starts and stops. This can cause damage and stiffen the joints. Swimming is helpful because water supports 90% of your body weight. What's more, it helps to develop physical endurance, is great for your heart, helps your circulation, and even combats fatigue.
So I move in the water is like dancing. To me, being in the water is what I don't dance on earth with the gravity. In the water, I feel like I'm dancing. The movement is rhythmic, is not strenuous, it's pleasant. I know I'm healing myself because I'm getting more oxygen in my system. My nervous system is working, my cardiovascular system is working, the muscles are working. I'm going to work a good appetite. My digestion is going to improve, reduce constipation, you know. And I'm going to be able to sleep like a baby. So swimming is good. What I have to do is increase more and more. And I learned something very important. I was doing, from 1 lap, I went to 20 laps. For a person in my condition, I thought was a tremendous good progress.
Jose knows the principle of starting exercise slow and easy, and building gradually is a good one to follow. He lets his muscles relax, breathes deeply, and listens to his body. Jose also does his own adaptation of range of motion and stretching exercises. The point is to move the joint through a full range of movement, and then push gently past that limit. This exercise has been particularly helpful for the pain in his hands.
So the first thing I do exercises, pumping blood. I pump blood into my fingers. The tendons are very stiff. I had to loosen up the tendons and the muscles to make it work, and I do this. That's the beginning of my hands, you know. Later on, in order to get more, I do this and put pressure.
The principle of these exercises is to work against resistance. So what you want to do is you always want to tense the muscle without moving the joint. And that's pretty easy to do.
Kate is one of Jose's mentors. She has taught him much about his disease and has developed self-management groups specifically geared towards helping people take control of their arthritis. Exercise is a big part of that process.
I'm going to show you one exercise for the shoulder, and then you can do it with me.
Strengthening exercises like this one can be invaluable. When you have a weak joint, one way to compensate for it is by making the surrounding joint stronger. It also helps the pain of arthritis because as the muscles become stronger, there's less stress on the joint and therefore less pain. In designing the ideal exercise program, you should incorporate some strengthening, range of motion, and endurance exercises into a daily routine. How much you do depends upon the kind and severity of your arthritis. Exercise is a basic prescription that can work for everyone, but you do have to develop a therapy program that works specifically for you. For every dose of exercise, you need some rest and relaxation as well. There is a variety of relaxation techniques you can try. Most achieve the same goal of relaxing tense muscles which cause pain. Jose finds playing the piano a successful way to unwind.
We have a technique, it's called distract your pain. So I distract my pain. I go to the piano and I get some new melody, and that gives me a little uplift. And I reduce it, you know. I compose one piece in music, in piano. I call it Rainbows of Springtime. Rainbows because it has all the colors of life, and springtime because it's a renovation of life. And that's what we're trying to do, renovate our lives every day.
Evelyn is extremely aware of the importance of relaxation techniques. She's convinced that tension contributes to her having flare-ups. The choice of relaxation techniques is a very personal one. For Evelyn, it's taking some time for meditation at the beginning of each day.
Usually I'll just make a cup of tea and sit down and put on a relaxation tape, just some music sometimes, and light a candle and write in a journal, basically about how the days have been going, what I'm hoping to accomplish, how I think the arthritis is doing now, and have I come further, am I going backwards, just sort of keeping tabs on things, or just writing down poetry. Anything that comes to mind is a really good way of meditating for me. People think meditation has to be sitting and saying, oh, I'm in a room or something, and it does, and it can be anything that frees you.
Evelyn also practices another technique which actually uses your tension as part of the relaxation process. For this, choose a quiet place and lie on your back. Moving from head to toe, you tense each muscle group and then relax. Start with your face. Tighten and then let the tension go. Move to your shoulders. Tighten and then let the tension go. Now your arms, your stomach, your legs. You can repeat this process again, but each time reduce the amount of tension you begin with.
Wonderful relaxation. Wonderful relaxation.
Relaxation and exercise techniques are two important ways that you can take control of your arthritis. They also make you feel better.
So I condition myself to do physical fitness, to learn to eat better, to relax better, and to look for massage therapy and acupuncture, whatever multiple therapies, prayer, meditation, rest, music, piano, guitar, ukulele, listening to music, looking at beautiful ladies, children, I mean, everything that was uplifting.
Despite myths to the contrary, there are no nutritional cures for arthritis. However, eating right can make a tremendous difference in how you feel. And no one knows that better than Sam Adams. Sam's a former football player with the New England Patriots who had to quit playing ball because his arthritis became too painful.
When I retired from pro football, I retired at 265 pounds. Inside of 6 weeks, I was 330 pounds. I retained the same identical diet, but I did no physical activity. The heaviest thing that I lifted was a can of beer and a shot glass. I celebrated my retirement.
When Sam gave up playing ball, he suffered what many athletes do, a sudden weight gain. Just what is the relationship between excess weight and arthritis?
Overweight, being too fat, does this cause osteoarthritis? We think that being overweight may damage joints that are already damaged. So if you have osteoarthritis of the knee or osteoarthritis of the hip and you're overweight, when you stand, if you put a certain amount of force on the ground and now you go to walk, you increase those forces by 3 to 5 times. So 50 pounds overweight becomes 150 to 250 pounds more on that joint when you go to walk. So we think that being overweight may be bad and may aggravate osteoarthritis.
My knees got worse. Right with the quick weight gain, my knees got worse. I found it very difficult to move around. I found it extremely difficult to go up and down stairs. Just the slightest bit of effort, I was out of breath. And just the slightest bit of effort, my knees were paining extremely, extremely bad.
While we know excess weight places an added burden on arthritic joints, particularly if your knees, hips, and feet are involved, what about the source of that weight? What role does a fatty diet itself play in arthritis?
There were some interesting experiments done a number of years ago. There is a strain of mice that gets osteoarthritis. And if you feed these mice lard, fats, they get more severe osteoarthritis and they get more of it. More animals get it and more severely. And somebody said, well, you just made fat mice, they're heavy, they get osteoarthritis. Well, if you take unsaturated fats like vegetable oils, bring the mice up to the same level, they don't get increased osteoarthritis. So it wasn't just the overweight. We know now that fats themselves may play a role in cartilage metabolism.
While the jury is still out on fats as a cause of arthritis, in terms of aggravation, it's still advisable to keep your weight down. Follow a diet that's low in fats, sugar and salt, and high in complex carbohydrates. That means eating plenty of vegetables, fruits, and starches, particularly whole grains, breads, and cereals.
The doctor gave me a choice, lose weight or have an operation. I chose losing weight. And I've gone on diets, I've gone on all the diets. I've lost 1 million pounds, and I've gained 2 million. But just recently, my wife and I decided to change the whole lifestyle. And we've gone on a 2-year program to lose 100 pounds.
There's a lot of curiosity about how specific foods influence arthritis. Can they have a protective effect, especially foods like potatoes and turnips? Well, as yet, there's no hard evidence establishing that fact. The anti-inflammatory effect of fish oils has also generated a lot of interest. It's based on the observation that people in Alaska have a lower incidence of arthritis. the therapeutic value of minerals like selenium and vitamins are also being investigated. There is evidence that for some people, flare-ups may be influenced by what they eat. Saturated fats and dairy products are two of the more common culprits.
If you're getting to rheumatoid arthritis, it's been shown that some individuals can actually aggravate their disease. And I think there are people who get worse symptoms. I have people, for example, who eat chocolates and will aggravate their rheumatoid arthritis. They get more symptoms. It doesn't cause it, it makes it worse. Who will eat tomatoes or citrus fruits, where this actually does happen. And there are studies where if you put patient in a clinical research center, take all their food away, just give them liquids and add one thing at a time, where certain subsets of people, you give them milk and their arthritis will get worse.
At this point, there is no nutritional cure for arthritis, but there are many reasons to eat well. It will help reduce flare-ups, make you feel healthier, boost your energy, and help you cope better with your arthritis.
You actually can't get over arthritis, but you can make a deal with it and live with it. And I think at this particular point, I know just about how to deal with it, which is generally speaking, diet, weight control, exercise, and mental attitude.
Billions of dollars are poured into arthritis treatment each year. Drugs can be an important part of the overall therapy program. They can effectively reduce pain and control inflammation. But what works is very individual. So we'll cover the broad categories of over-the-counter and prescription drugs that are now available. But please keep in mind, if you are on drug therapy, you're the best judge of what works and what the side effects are. Don't rely on your doctor for all the answers. Aspirin is the first line of defense in treating osteoarthritis or early forms of rheumatoid arthritis. Taken in small doses, 2 tablets every 4 hours is needed. It can have an analgesic or pain-relieving effect. In large doses, 10 to 16 tablets a day, it can be a major anti-inflammatory agent, reducing swelling and inflammation. Aspirin is usually prescribed first, since it has the least number of side effects.
It turns out that roughly 1 in 10 people, I guess, will get aspirin side effects. It turns out to be a lot lower than one might expect, because when people are told they're taking aspirin, they anticipate getting stomach side effects.
There are ways of counteracting side effects. Coated aspirin, for example, can protect your stomach. There's also the option of aspirin substitutes, the so-called non-steroidal anti-inflammatory drugs. More costly, they're as effective as aspirin and have fewer known side effects. Doctors are also now experimenting with using combinations of drugs.
The idea there is to use smaller doses of more drugs so that you may still get the effect but reduce the chances of side effects. And I'd have to say right now that is quite a controversial issue. Some of the combinations are very simple, such as using aspirin and Tylenol at the same time. That's perfectly simple and quite appropriate. But when you get into more potent drugs, the issue of combining them is very, very controversial now.
Many people question whether all drugs are created equal. What's the difference between generic versus brand names?
The first thing to recognize is that drugs have 2 names, the so-called generic or general name, which is a chemical type name for the drug, and then a brand name, which is used in the marketing and so forth. Once drugs have been available for a while, they go off patent and are then available in what's called a generic form. That means that it may be produced by a different company, and generics are almost invariably less expensive.
And within a brand, what is meant by the claim extra strength versus regular? Quite simply, extra strength means you're getting more medication per tablet or pill.
They can get exactly the same dose by taking, say, 3 regular strength tablets as they would if they took 2 extra strength tablets.
Now, in treating rheumatoid arthritis, there are options beyond aspirin and non-steroidal anti-inflammatory drugs. This second level of medication is considered to be more potent. They also have a greater potential for side effects. Gold salts, Plaquenil, and a recent addition methotrexate are 3 of the harder-hitting drugs. They can not only reduce inflammation and pain, but may also increase range of motion.
Gold salts remain perhaps the most commonly used drug for patients whose rheumatoid arthritis doesn't respond to more common therapies like anti-inflammatory drugs and aspirin. It's a course of treatment that involves weekly shots in intramuscular injections over the course of about 4 to 5 months. And about a third of the people who get those injections will have very substantial improvement in their rheumatoid arthritis. A number will go into what we call remission, which is total alleviation of their symptoms. And the nice thing about gold is the people who get the good effects can have it last for a long period of time.
I take gold capsules in the morning and gold capsules at night, and I'm worth a lot more now. No,
Evelyn was switched to gall salts after simpler drugs proved ineffective. The benefits have been remarkable. On the downside, rashes, kidney disease, and blood cell problems are possible side effects. You should also know that this is a drug that often takes several months to work.
Medical people don't even know what the gold really does, and that's sort of the weird thing about when you have something like arthritis, because you say, then what actually is this doing? And a lot of times they come back and say, I don't know what it actually is doing, but all I know is that they have found that it works with some people.
For patients who don't respond to gold or Plaquenil, there's a third level of treatment.
Those are more potent drugs, many of which were originally designed to treat patients with cancer, but have been used for people with very bad rheumatoid arthritis. And Imuran and Cytoxan are the drugs that fall into that category. There are 2 other approaches to treatment that can be used at any point in time, along with those 3 levels of drug treatment, and that's joint replacement surgery and oral corticosteroid therapy.
It's amazing how quickly you feel better on steroids. It's a little scary, but good in the same way, because you know it will help you get through certain times. Within 24 hours, my joints felt like my joints again. They didn't feel like somebody else's joints.
Steroids, while quite effective, tend to be medicines that have to be used over a long period of time. And they have side effects. The most worrisome side effects are thinning of the bones. They accelerate osteoporosis, which many women are already concerned about, and that can be made worse with steroids. They can also have effects on diabetes, high blood pressure.
In addition to oral steroids, treatment by injection has proven very useful.
The average person with arthritis, injection of steroids into the joint can be a very effective form of anti-inflammatory treatment. And it's particularly useful when someone has one joint that really is their major problem.
For the vast majority of people with arthritis, drug therapy can work safely and effectively. But whether it's aspirin or steroids, gold shots or Cytoxan, only you can judge the success of a particular treatment.
People think that the physician has to tell them whether the medication is working, for example, when in fact, the patient tells the doctor whether the medication is working. So my best judge of whether a medicine is working, for example, is not to examine the patient necessarily or even to do laboratory tests. It's simply to ask the patient.
One of the greatest advances in treatment is joint replacement surgery. Surgeons can now replace the hip, the knees, the ankle, even the fingers. But in spite of overwhelming success, surgery is still reserved for those people with severe disease or limited mobility. There are criteria doctors use to assess potential candidates. How severe is your pain? Does it limit your daily activities or keep you from sleeping at night? How overweight are you? Excessive weight increases the burden on a new joint. And your age. Joint replacements today last 10 to 15 years. So the younger you are, the more likely it is that you will need a repeat surgery. It was 25 years ago, when she was in her mid-20s, that Marion Salvo found out she had arthritis. Like many people, she denied her condition at first, even as her symptoms were growing in severity.
I didn't want anyone to ever for a moment think that Marion's slipping because this arthritis is really getting to her. And I did have a responsible position at the time, office management, and so I wanted to continue to do the job that I was doing. But it became extremely painful, very, very painful.
Time went on, 24 more years in fact, and Marion felt her hands getting progressively worse. Her legs were so bad she could barely walk or drive. Every movement was agonizing.
My arthritis was all over my body, 100% over my whole body. I had it in every joint that you could have it in, even in my jaws. And there was a period when I had to take all my meals through a straw. It was impossible for me to even brush my teeth. You just found yourself engulfed in darkness with such pain, agonizing pain. and you can't even stand the weight of a sheet on you. I was filled with anger. I was so mad at having to have this arthritis in my life. So because I was so desperate to get back to the life I had been leading, I fell for everything that came along. My ears were just tuned in to anything that had to do with arthritis. Drink lemon juice, mix cod liver oil and milk, take straight Peptin in the mornings, bathe in brake fluid. I mean, I laugh about it now, but to me, they were very serious matters.
While searching the globe for a miracle cure, an enormous gap was widening between Marion and her husband.
I think he was afraid of how it was going to leave me, a total cripple. I think just the fear of what does the future hold for her? What does it hold for us? Because we had all those dreams that every middle-aged working family has.
While she was at a nutrition clinic in Texas, she finally acknowledged how completely arthritis had taken control of her life. A psychologist convinced her it was time to turn her life around.
One of the things he said to me was, "Marion, I absolutely don't know why you're still alive." He said, "You are surely going to die." He said, "Not only from your physical illness, but also if you don't get your emotional illness straightened out."
Marion returned to San Francisco and eventually found her way to an orthopedic surgeon. She weighed only 88 pounds at the time, was emotionally drained, and had gone through a traumatic separation from her husband. She was now ready to consider surgery.
After examining her and going through the x-rays, we sat down and had a long chat about how much courage it would take on her part to go through all this and to have 2 hip replacements followed by 2 knee replacements and all the rehabilitation.
They told me I'd never walk again if I didn't have surgery. There was no way I would ever walk again. It's true.
Proceeding with surgery did take an enormous amount of courage, but Marion was not without her share of fears. Fears shared by anyone facing any kind of surgery.
Some of the things that the patient fears the most about surgery is, number one, the anesthetic. People are afraid of going to sleep or of even having a spinal anesthetic because they lose power. They lose the ability to control their own destiny. The other thing is it going to be successful? Even though they know that there's a 95% success rate in hip replacement surgery, am I going to be in the 95% group, or am I going to be in the 5% that has the problems? The very best patient for surgery of arthritis would be the one who has 1 or 2 joints that are extremely bad and the rest of their body is in fairly good shape. The other patient who is very good candidate for surgery is the one who has severe disease like Marianne involving many joints, and we can do several operations to help them. I think Miriam's, the way she went through her first 4 surgeries, her 2 total hips and her 2 total knees replacements, is extremely common. It seems like it's going to be a very difficult thing to undergo, but 90 to 95% of the patients that undergo it have successful outcomes and become good walkers, and many of whom, like her, don't even use canes or crutches.
Marion's a survivor. She wanted quality back in her life and to prove to her 3 children that she could go through this and be well again. After 9 surgeries involving her hips, knees, feet, and neck, surgery saved her life. She knows that this type of surgery doesn't last forever, usually 15 years, and there are still good days and bad. But she's regained her independence and positive thinking.
Even at this point in my life, I have arthritis. I know there's no cure for it. I have a lifestyle that I manage it fairly well, but I have days when it's no good at all, and I don't want to even get out of bed. I hurt, even with all my replacements and everything. But I will never despair like I did.
Marion also knows a crucial part of rehabilitating herself is learning to be as independent as possible and staying active through an exercise program.
I think most people are thrown by the word exercise. They think, well, you have to do well to exercise. You have to do an aerobic type of exercise. It's something that really has you all gung-ho. But with arthritis, you have to do very passive exercise, but you have to do it consistently.
We tell our patients, no matter what happens, we don't want you to run or jump the rest of your life. You can swim, you can play golf, but we don't want the kind of activity where there's a pounding.
Surgery isn't the answer for everyone, but it worked for Marion.
think the biggest thing that surgery does, and when I think we're talking mostly here about joint replacement surgery, is that it takes away pain. The pain is gone 95% of the time. The average patient can get in and out of a chair, on and off of a toilet, up and down stairs, in and out of bed, without assistance and with the same kind of, nearly the same kind of skill that a normal patient can. So it really changes their life completely.
Surgery made it possible for me to have a life that had some meaning to it. I didn't have to be totally laid up in bed and count on everybody to take care of me. It's really a miracle that I was alive.
Living with arthritis can generate a number of complex feelings that people have a tendency to keep inside them. It's important to let others know how you feel and how they can help. It can also be beneficial to talk with someone who has a similar condition as you. At Stanford University, Kate Lorig trains people to teach support groups. And she's found, as others have, that for those who learn to share their feelings and actively manage their condition, they do better.
There's lots and lots and lots of things that can be done about arthritis. The disease can't be cured, but people can certainly learn to live with it more comfortably. And so what we do is we teach people all the things that they could conceivably learn. And we teach them that it's a little bit like a smorgasbord. What we say is, look, here's all the stuff we know that have helped people. And what we urge you to do is try these things, and if they work, that's great, keep doing them, and if they don't work, that's okay too.
Getting out of a car has been hard. I never know whether my knee is going to hold me or not.
Does anybody have any suggestions that might help Marianne?
My car has a handle right up over the door. I think you probably could have one installed. Then you can use that and swing your legs around. That's what I do and get out.
What I started doing in our class was use the distraction technique to pretend that I'm floating, and so that immediately as I'm getting up, I'm just, the weight is all up.
Kind of heavy for that, but I'll try.
We teach them a whole range of pain management techniques. Relaxation, some self-talk, some distraction techniques. And a lot of our very, very best ideas come from people with the disease. One of our leaders told us that morning stiffness is a big problem for people with arthritis. And she said that the first thing she does in the morning is she thinks of herself first as a cat and then as a dog. And we said to her, Ruth, what are you talking about? And she said, well, when I get up in the morning, the first thing I do is I do what a cat does. And what a cat does is a cat stretches. And she said, then the next thing that I do is I get out of bed and I shake all over like a dog. And that's the way she deals with her morning stiffness.
The support group not only provides creative health tips, but much needed empathy that's often lacking in people's lives, especially when grappling with a disorder that's frustrating and not always visible.
This is a disease that unless you look for it very carefully, you can't see. Its major manifestations are pain. And when somebody looks healthy, it's very hard for somebody to believe that they're really in as much pain as they are. And so I think people say, yeah, I really know what it's like. It's very hard, for example, for a young, virile man to have to go to the grocery store and say, I need help out with my groceries. I look healthy, I look like a football player, but in fact, carrying groceries is agony for me. To live constantly with pain, with disability, is something that you can't truly understand until you have to do it, and I hope that folks don't have to do it. People believe that they can do things. They probably can. It's a theory that we're working with called self-efficacy, and so we're doing a lot of work in helping people believe that they can do things.
But how do all the people who finally believe they can do something get themselves started?
Would you like a rule about how to start doing things? Okay. A simple rule, no matter what it is that you want to do, think about what it is that you can do now. You walk 2 blocks. You can walk down 2 steps, whatever. Say, okay, I'm going to do that 4 times a week. And then add to it little by little. You add to it by about 10%, 20%. So if you're walking 2 blocks this week, next week walk 2.25 blocks. Next week, walk 2.5 blocks. Little by little, set goals for yourself.
It's a technique that works.
It's made me feel more confident that some of these ups and downs of just trying to live through life are normal, and how do you deal with chronic pain and fatigue. And I think what I've learned is that to kind of moderate my schedule.
Although you can't do anything as normal as you did, you feel that you realize you're lucky that you can do anything. Where so many of the people in the class when we first started were just thinking what they couldn't do anymore.
Two main things I got out of the course were, one, finding out that I had options I never knew existed, and getting to experience those and trying them out and seeing what worked for me. And the other big thing was seeing how much other people could help me.
Jennifer Adams is a good example of how all of these principles can be put into practice. Since the age of 4, Jennifer always dreamed of becoming a dancer. But by 10, that dream was brought to a blinding halt.
I got on a bicycle on my 10th birthday, and I went to lift my leg over the bar of the bicycle, and I couldn't lift it. It was just pain every time I moved my hip.
When Jennifer was finally diagnosed as having juvenile rheumatoid arthritis, she could have let all of her ambitions go. Instead, she refused to be defeated.
I felt like the arthritis at times was taking over my life, especially my dancing.
Jennifer's philosophy is that you don't stop living because of your arthritis. You just redirect your ambitions a little. She changed her focus from dancing to teaching, but still gives herself time to dance on her own.
I mean, you just can't stop living because you have something in your body that makes things a little bit more painful. But you have to keep yourself moving and active, even if it's keeping your brain active.
The bottom line is whether people want to sit around and say, oh dear, oh poor me, and do nothing for the rest of their lives, or whether, like some of the people you've shown here, they want to get on with their lives. And people that get on with their lives do amazing things.
You can feel good with your arthritis, but it means making a commitment to exercise, to eating low-fat foods, to taking your medications properly, to maintaining a good attitude. In short, it means taking good care of yourself and accepting the new you with arthritis. Now that we've motivated you, let's go through a series of strengthening and stretching exercises that you can use daily. Remember to use this tape at your own pace. There'll be good days and there'll be bad days. And if you need to stop, stop. But always remember that you can feel good with your arthritis. We can begin our stretching by laying on the floor or bed, breathing normally, and remaining relaxed. We'll start by stretching our hips. Legs are straight. You can slowly open your legs to the side, just as far as you can. Hold it. Try to relax. Hold for a count of 8. 1, 2, 3, 4. Terrific! 6, 7, and 8. And now, slowly close the legs. Now we're going to bend both knees. Feet are flat on the mattress and slowly grab behind your thigh on the right leg, relaxing your knee. We're going to stretch our back now. Hold for a count of 8. 1, 2, 3, 4. We're almost there. 6, 7, and 8. And slowly lower it. Good. Now the other side. Grab behind your thigh. Hold. 1, 2, 3, 4, 5, 6, 7, and 8. And slowly lower it. Now we'll slowly stretch our knees, picking up the right knee, extending the leg out so that it's straight, and pulling it back for a count of 8. Here we go. 1 and in. Slowly breathe. 2 and in. 3 and in. 4 and in. 5. 6. Slowly bring it in. 7 and in. 1 more. And 8. Good. Same thing on the other side. Pull it in for 1.
and 2. Pull it in. Extend it for 3, 4, 5, 6. Work at your own pace. 7. Last one. 8. That stretches the knees for the morning. Good. Now you're ready to get up, get out of bed, and do the standing stretches. Feet together, take a deep breath. Inhale up, just halfway, exhale, and down. Now we're going to stretch the joints of the fingers. Take your left hand and slowly curl your thumb into the palm of your hand. Then your next finger. Then your next finger. Then your next finger. And finally your pinky. Roll it into the palm of your hand. Now switch hands. In your right hand, take your thumb and curl it into the palm of your hand. Your next finger, curl it in slowly. Your next finger, curl it in slowly. Stretch it into the palm of your hand. Your next finger, curl it in slowly. We're almost there. Now your pinky, curl it into the palm of your hand. Take your fists now and open and close them. Open and close them. We're going to do this for a count of 8. Open your fingers as far as you possibly can stretch them. Now close them. Open and close them. We're almost there. You're doing terrifically. Open and close them. Open and close them. A few more. Open and close. Open and close. This will be the last one. Open and close. Terrific. Now both hands open wide, clasping your hands together, crossing your fingers and pressing your wrist. We're stretching the wrist now, first to the left and then to the right. Left, pressing it gently to the right. To the left, to the right. Breathe comfortably. Be relaxed. Terrific. To the left, to the right. One more time. To the left, to the right. Now we're going to circle our wrists outwards. Circling the wrists, relaxing those wrists, gently stretching them out for a count of 8. Moving your wrists outwards. Terrific. Breathe normally, be relaxed. Terrific. Roll those wrists. A couple more times. Terrific. Now to the inside, slowly circling it inside for a count of 8. Relax your breathing. Shoulders are down. Try to relax your upper body. You're stretching and relaxing. And now we're going to stretch the forearm just like you're twisting a doorknob. Out, then in. Twist it out and in. Out, just like you're pulling your thumb under and over. Under and over for a count of 8. Elbows should be by your side. Out and in. Out and in. Now we're going to stretch the elbows. Elbows by your side. Bring the arms down and slowly curl them up and down. Slowly curl them up for a count of 8. Breathing normally. Keep your shoulders down. Don't tense up that neck. Breathing and relaxing normally. Up and down. Up and down. Keep those shoulders down. Up and down. And one last one. Up and slowly bring in the hands by the sides. When you bring them up this time, we're going to stretch out the shoulder on the right side. Pick up your elbow, bring it across the body, holding it with your left hand, and let it stretch and relax. And hold for a count of 8. Terrific. Now the other side. Hold, relax, stretching that shoulder, keeping the elbow high, and relax. Great. Now we're going to circle the shoulder sockets around to the outside first for a count of 8. 1, 2, 3. You're doing very nicely. Slowly, work at your own pace. It doesn't have to be as fast as we're doing here. Now to the inside. 8 counts to the inside as well. Rotating that shoulder cuff. and hands by your sides, breathing deeply, stay relaxed. You're doing terrifically. Now we're going to stretch the back of the neck. Wake up the spine. Chin goes down to the chest, and chin comes back to the center. It's very important that you don't take your chin all the way back. That puts too much pressure on the spine. Chin down and center. Down and center. Do this for a count of 8. Down and center. And now take the right ear to the right shoulder, and then to the left. Slowly over to the right, and slowly over to the left. Right and left. Remember to breathe deeply, to stay relaxed. Keep your shoulders down. Finish off the set by inhaling up and exhaling down. We'll begin your strengthening exercises by working on your neck and back. Bring your knees up. Hands on top of your thighs. Slowly curl up, chin to your chest. You exhale up and inhale back. Breathing through your mouth, now breathing through your nose. Exhale forward, inhale back. Do this for 8 repetitions. If you can't get through all 8, do it at your own pace. It will give you a goal to work for. Remember, you're not only strengthening your neck, but you're strengthening your lower back and your stomach as well. Exhale up, inhale back. Now to strengthen the hip, bring the knees slowly over to the right side. Breathe normally, relax. You'll feel some pressure in your hip. Hold for a count of 8. Great. Bring over now to the other side. Again, hold for a count of 8. Breathe normally. Stay relaxed. You're doing very well. Now to strengthen our ankles. Bring both the feet flat onto the floor, pressing the ball and the heel of the foot into the floor. The force is directed downward. Hold for a count of 8 and release. Now you can extend your feet straight out in front of you. Flex your left foot. Tighten your knee and release. Flex and release. Flex and release. Do this for a count of 8. Breathe normally. Stay relaxed. You're doing well. Flex, release. Flex, release. Flex, release. Now to the other side. Flex your right foot and release. Flex and release. Breathe normally. Stay relaxed. You're strengthening your knee at this point. Flex, relax. Flex, relax. Breathing is very important. Stay relaxed. Flex, relax. Flex, relax. Now you're finished. Slowly come up. A nice long torso is important. Stand up nice and tall. Breathe deeply. Inhale and exhale down. Now we're going to work and strengthen our fingers, pressing the forefinger of our hands into our thumb for 2 counts, and then the next finger and the next. If you have rheumatoid arthritis, do this very gently. Breathe normally and stay relaxed. Now we come down and we're going to strengthen our wrist. We press down with the palm of our hand while pressing up with our wrist. Don't bend the wrist. Hold it for a count of 8 and release. Go to the other side. The same thing. Hold for a count of 8 and then release. Make sure you don't bend your wrists and breathe normally and stay relaxed. And now we'll strengthen our elbows. On the right side, using the left forearm, pressing down on the right forearm and holding the tension for a count of 8. Pressing up with the right forearm and pressing down with the left. Switch to the other side, resisting the energy. Breathe deeply. Stay relaxed. Keep your shoulders down and hold for a count of 8. This just strengthened your elbow. Now we're going to strengthen the shoulders, bringing the right arm straight down and trying to move it away from the body while resisting that movement with the left hand. Hold for a count of 8. Now switch to the other side. Try to move your left arm out and hold with your right hand. Breathe normally. Hold for a count of 8. You're doing very, very well. For hip strengthening, turn to the side. We're going to squeeze our buttocks in and then release. Squeeze and release. Squeeze and release. Squeeze and release. Standing up nice and straight. Shoulders down, nice long neck. Straight back, stomach pulled in. Squeeze the buttocks under and release. Squeeze it under and release. Take a deep breath, inhale and exhale down, finishing off the set. Now you're ready to start the day.
Now that you've given your body the attention it deserves, it's time to focus on your mind. Half of the ability to stay young and vital comes from your own belief that it's possible. The visualization techniques that follow will guide you in achieving that renewed state of mind. These exercises are also a wonderful means of distressing yourself. They give you a practical way of getting away from it all without stepping foot outside your door. As we all know, stress is intimately tied to your health. And even though medical researchers are still working to isolate the precise role of stress in the onset of various diseases, few practitioners would argue that it does indeed play a part. Plain and simple, there's no added value in hanging on to your stress. It's one thing you can willingly let go of. All right now, let's begin. Pick a comfortable and quiet place to lie down. Just let all of your muscles relax. I want you to breathe slowly and naturally in through your nose and out through your mouth. Once again, in through your nose, out through your mouth. That's it. Now we're going to work on letting go of the tension from every part of your body, starting with your feet and your legs. All right, feet and legs. Tighten them. Now let the tension go. Huh? Feel that? Now we move up to your stomach muscles. I want you to tighten them and then let go of all that tension. Now your shoulders. Now your hands and fingers. Your face and eyes, let the tension go. Now, focus on your mind. Feel your thoughts drift away. Let all the worries go. Because now we'll replace them with other images. First, imagine that you're young again. You have no worries, not a care in the world. It's a time when anything is possible. Everything you want can be yours. You're filled with energy. Your body is strong. You feel like you could play and keep moving for hours. You don't want to stop. Life is wonderful. Keep those feelings of strength and energy as we now move to a quieter place where you can simply relax and let all of your thoughts now go. You're by the water. You can smell the freshness in the air. There's the fragrance of flowers. You can hear the gentle motion of the water. The boat